Good afternoon, and thanks again for joining us today. As of 2 p.m. today, there have been 8,754 positive cases of COVID-19, including 358 deaths. Over 92,000 people in Missouri have been tested at this time. Before I go on to some other remarks, I do want to remind everybody, there's been a lot of information this weekend on the testing, especially at the Triumph food processing plant up in Buchanan County. One thing, and then Dr. Williams will talk about this in more detail when he comes up this afternoon, but just a couple of things I just want to make sure that everybody understands. When you pick a particular plant like that one was, that we did all the testing, we did about 3,000 tests in that plant, and we come up with 300 plus that were positive. Those people are all in quarantine now, which is the good news, so we've got them separated. But I also want to mention we did 3,000 tests, roughly 3,000 tests over the state of Missouri randomly over the weekend also. And of that 3,000 tests, there was 9 come back positive. So I think you always have to remember what the locations are. And again, you have to take all the numbers as a whole to see how it affects the entire state. So I think that's important that everybody kind of needs to understand that's going on also. And we'll talk about that. Dr. Williams will talk about that when he's up here a little bit. But today, phase 1 of our Show Me Strong recovery plan took effect, and we are prepared and ready for this next step. But as businesses reopen and Missouri's re-engagement in the economy, I want to remind everyone to be safe, to be smart, and to be responsible. We are on the road to recovery, and we must continue to be proactive and maintain social distancing to protect ourselves and everyone around us. Earlier today, Teresa and I visited businesses in southwest Missouri to discuss our recovery plans and learn more about how they have adapted to the COVID-19 crisis. And it was encouraging to see how these businesses, as well as so many others across Missouri, have adjusted to these challenges and precautions they are taking to keep employees and customers safe and moving forward. One of the things is we went to the businesses around the state today, and you've seen some of the things they've implemented in. One of them was CDL over in Joplin. We went to a pretty good-sized business, heat and air business, where how they had adapted for their employees to go meet the customers and what they had done for their employees, whether it be masks, whether it be protective gear, whether it be the hand sanitizer, everything they had put for those people that are still working that worked during that time, along with what they had available for the customers. I know we went to a DAV shop also in Joplin over there where they sell items, and which was a fairly significant business there. Most of the employees there were wearing masks. They had the opportunity to wear a mask if they so choose to do that for them waiting on the customers there today. And I think as we went to Springfield, again, we was at Bass Pro. Again, a lot of the employees there were wearing masks today that there was going to be there in those shifts. And then we went to Cox South, that most of you know. And at that point, when you went in there, we were required to wear a mask. So me and the First Lady both put a mask on to go into that. I think it's important when you look at some of the things that they were doing as far as like in the retail businesses, they were actually had shields up for the cashiers to the customers that come through. There are a lot of innovative things, a lot of markings, a 6-foot distance. So I was really pleased to see the efforts, the businesses were putting forward, and really that people were understanding how important it was that social distancing was going to be part of our future for a while. So I think that's important. I think the other thing, there's been a lot of discussions about masks. Do you wear a mask? Do you not wear a mask? A lot of information on both sides of that. But I'm going to go back to what I've said all along. It really goes back to your personal responsibility. Do you want to wear a mask? Do you not want to wear a mask? If you're going into a business and they want you to wear a mask, then wear a mask or don't go in the business. If you're working there and you feel comfortable wearing one all day long, then by all means, I think the businesses should provide that mask for you if you're employed there and you feel safe. So let me just cover some of those things. But it was really encouraging to see the businesses really working and what they were expecting out of the customers coming in there. So it was a good way to start Monday off. It was good for me and the First Lady to be out there, see firsthand what was going on, and some of the things that everybody's trying to put together to open up the economy here in the state of Missouri. Throughout the COVID-19 crisis, I have signed multiple executive orders to assist our response efforts. Today, I signed executive orders extending 4 of these previous orders through June the 15th, including Executive Order 20-04, easing regulatory burdens. Executive Order 20-5, allowing the sale of unprepared restaurant foods to the public. Executive Order 20-06, mobilizing the National Guard in response efforts. And Executive Order 20-08, waiving the requirement of a person to be physically present in front of a notary republic. These orders through June the 15th is consistent with the state of emergency extension and gives Missouri more time to adjust to the reopening. Today, we will also be distributing the CARES Act funding to local governments. COVID-19 has had an overwhelming impact on our economy, and many local governments, healthcare providers, education institutions, businesses, and other groups will rely on this funding. As we work through this process, I want Missourians to know that we'll be as transparent as possible. As of April the 10th, I established an informal working group led by State Treasurer Scott Fitzpatrick to help make recommendations on the best use of this federal funding. The Treasurer's Office has also established a web page to provide updates on the working group and CARES Act funds. We hope posting this information in one public place will help Missourians stay up to date and feel confident that we are working hard to make every dollar count for the people of the state of Missouri. Today, Treasurer Fitzpatrick is here to provide us an update on that. Scott?
Thank you, Governor. Good afternoon. As you know, several weeks ago, Governor Parson appointed me to chair an informal working group to make recommendations for the use of federal funding provided for COVID-19 related expenses under the CARES Act. Last week, the working group on Tuesday held a public meeting to discuss a certification form for local governments to sign, as well as to fine-tune the distribution amounts that would be distributed to those local governments as outlined in the supplemental appropriations bill passed by the General Assembly and signed by the governor. The governor, the same day, quickly reviewed and approved both recommendations from the working group, following which my office distributed the certification document to all the counties in the state of Missouri, as well as the city of St. Louis. As of this afternoon, payments have been processed to 105 Missouri counties and the city of St. Louis, payments totaling approximately $468 million. This means that those local governments are going to have access to that money in their accounts by Wednesday. Over the past week and a half, my staff and I have made hundreds of phone calls, making direct contact with Missouri counties regarding these coronavirus relief funds. To date, 7 counties have not yet submitted completed certification forms, and those counties will not be eligible to receive their funding until they do return that form. So far, those counties are Osage, Platte, Randolph, Stone, Sullivan, Clinton, and Clay. It's worth noting that I believe Platte County is meeting later this week and is expected to return theirs, and we've been in discussions with Clay County over some challenges they've had with some of the language, and we'll be addressing that. I want to urge the leadership in each of those counties to work together and submit their certification forms as soon as possible, and to contact my office if they have any questions or concerns. Because there's been some confusion in the press about why the city of St. Louis is receiving funds directly from the state and not the city of Kansas City, which is the state's largest city, I'd like to take a moment to discuss this. The CARES Act passed by Congress allowed for local governments with populations over 500,000 to apply directly to the federal government for aid. In Missouri, Jackson County and St. Louis County made that cut. Kansas City, unfortunately, fell just short of the required 500,000 person threshold using the 2019 population estimates as required by the CARES Act. Unlike Kansas City, which is located within 4 separate counties, the city of St. Louis is unique in that it is a city that is not within a county. The city of St. Louis is not part of St. Louis County, and as such, it's eligible to receive its own portion of the state funds directly from the state as written in the supplemental appropriations bill that was approved by the governor. So I'm proud of how quickly we've all worked together to get this money to Missouri's local governments, and especially appreciative to the governor for his quick review and approval of those disbursements. Missouri has been a national leader in distributing these funds to local governments this quickly. It's my understanding in discussions on calls with the National Association of State Treasurers that other states are planning to use the certification form developed by the state of Missouri as the basis for their own distributions to local governments. I want to thank the General Assembly, the members of the working group, and Governor Parson for making that quick disbursement possible. As the governor said repeatedly throughout this crisis, local leaders understand the needs of their communities better than state government. Getting this money downstream to counties will help ensure it will get to those who need it quickly, whether that's the health departments, healthcare workers, first responders, or even small businesses that have been impacted by closures in their counties. We're counting on our county leaders to work with other municipal governments within their counties to ensure these resources are put to the best use for citizens of the county. And this is a time to come together for the common good of Missourians. I do want to thank the county leaders. I talked to several of them myself, as well as the ones that were talked to by my staff, and they have all almost 100% of them have been enthusiastic and willing to step up to the plate and help be a hub for distribution of this money in their counties. They understand the requirements that go along with that, and we're looking forward to continuing to work with them. I also want to highlight the governor mentioned the webpage on the Treasurer's Office website that has been launched to provide information regarding CARES Act funding. Will be, as more information becomes available, we'll continue to update that website. And you can access that by going to the homepage at treasurer.mo.gov, and there's a link right there on the homepage to that website. We all want Missouri families, businesses, schools, and communities to thrive, and we have to work together to get Missouri back to work, and I'm thankful for the governor's leadership in doing that. Thank you.
Scott, thank you very much. Thank you for the work and your team over at the Treasurer's Office. I might want to add to, we were very fortunate to have the State Treasurer to be able to help with this format. One of the things we all know as we look back at COVID-19, it seems like it's been here months upon months upon months, but really it hasn't been here 60 days yet as we know of it, since it's really all started for our state, our reactions. A lot of things have happened within that 60-day period, all the way from all this federal money coming in, unprecedented. When the federal government acted as quick as they did and they shipped that money to the state level. It was important for us for day one to reach out to the Treasurer. We knew he was going to be distributing that money, to be part of that process, to make sure, one, that we took our time to get it right, to make sure that distribution was going where it was intended to go, where it was supposed to go. And the other thing, that we were transparent about it, that we could put that information up almost immediately once we did. I think last week when you've seen what happened when the disbursement of the counties, I think they had a meeting shortly after that. Again, the media had that information. They were able to put it out to the general public. And you will see us moving forward of all of that federal money that comes in to make sure, one, we're taking the time to make it get distributed correctly, and two, that you'll have opportunity to see that, not only you as the media, but also the general public will have the opportunity to see where every one of those dollars goes, because that's going to be important to us. Let me just say in closing, I've said many times, this reopening is a gradual process. Things are going to look different for a while, but we are on the right track. It is encouraging to see businesses safely reopening and abiding by the guidelines. And we must continue to prioritize the health and safety of our families, friends, and fellow Missourians throughout this process. So again, use common sense, social distance, make safe, smart, and responsible decisions. We have a long way to go, and if we keep up these efforts, we will recover from this challenge. Thank you, and God bless. Kelly, let's open it up for questions.
Hello, Governor. I know that you mentioned masks before,
Right.
and you went to the DAV in Joplin, and there were a lot of veterans who were wearing masks.
Right.
Why did you personally not wear a mask?
I chose not to.
When the public goes out of their houses because it's Monday and the loosening of orders happened today, do you encourage the public to wear masks?
I think it's up to the individuals. I don't think that's government's role to mandate who wears a mask and who don't. I think it works perfectly simple. The business owners there provided masks for the employees. They want them to wear them. That's the way it should be. If you want to wear a mask and you go into business, then wear a mask. But if you don't, I don't think it's government's place to regulate that. I think everybody, again, I'm going to go back to what I've said all along. It's your personal responsibility. Just like you wearing a mask here today, you want to wear one. Nobody required you to wear it or not wear one today. You want to do that, and I think every individual should have that freedom to do that. Again, common sense, self-discipline, your choice.
The state does recommend, though, 6 feet of distancing, but especially in large gatherings. But if you go one floor up to the Missouri House of Representatives, there's a lot of people packed into a not big enough room, and a lot of them are not wearing masks. Do you have an opinion about that? Do you think that there should be social distancing there and masks?
Asked and answered. It's up to them. If they want to wear a mask, wear a mask. I believe they're essential to be in here to be working right now. So if you wear a mask and you're in that position, there's guidelines that tells you what to do.
In your opinion,
but the
though,
House of Representatives need to make that choice, not the governor's office for them.
In your opinion, though, are they violating the social distancing order?
In my opinion, they're doing what they took an oath to do, to be here and represent the people of their districts.
Governor, I know this is day one, but come May 31st, what would success look like to you in terms of this first phase? And do you have a timeline yet for phase 2?
Yeah, you know what? I think the next 2 weeks are really critical. I know the order goes to the end of May, but I think to see where our state's going in the next couple of weeks, one, I think you go out like today and you say, okay, are we really abiding by these orders? Are we doing what they're supposed to be? There's going to be incidents, I'm sure, where there'll be a group of people together that shouldn't be together. We all kind of know that. But the reality of it is, I believe most of the people here understands the significance of this and how serious it is still with this virus, because that virus is still out there. It's not going to go away. People are still going to get sick, and some people are going to die, and that's just the truth of where we're faced. But we got to do both. We got to open up the economy, and we got to be able to fight the virus at the same time. But I really think I will look at the data each day, as we have for a month now, to see where we're headed towards the middle of the month and then where we're at to the end of the month. Again, it'll be a slow process to make sure that public safety is at the forefront of the decisions we make.
Governor, we saw 368 new cases today. It's the highest single-day jump. Do you still think that reopening today was in the best interest of the state, as we have not seen that continual 2-week decrease in case numbers here in the state of Missouri?
I do, because again, you have to take the numbers across the state over a time period. If you use that number like you just used it, it sounds plenty bad. But if you really put it in the context that over 3,000 of those tests were done at Triumph Food Services up there, and 300 and some of them were tested positive, or whether you say the 3,000 we did at random in the state, there was only 9. So it depends which store you want to put, or do you want to put them together. Depends how you want to do that. But I think the important thing to do is why I think these briefings are so important, because people need to understand that the reason we have hot spots, the reason we target those places to go in there and do that massive testing in those places, and it worked exactly what we wanted. Do we want 300 and some odd people to test positive? No, we don't. We're fortunate they were asymptomatic. But the reality of it is we could go right away and we could isolate those people. And then if you look at the rest of the tests around the state. So I think it's important for the whole story to go out there so people understand that, So I think that's what we're trying to do every day when we tell this, and why the numbers can definitely be misleading if you want them to be misleading. For example, I think the number I used today, as I said last week, we've had 8,754 positive cases. That's a total since day one.
Out of how many tested, do you know?
Pardon me?
Do you know of how many have been tested since day one?
92,000.
92,000.
Yep.
Can you talk about, if you look at the graph that is posted on the Missouri Health Department's website, it is not a gradual curve down. There are ups and downs. So what does it mean to see a 2-week decrease as the White House is recommending?
Yeah, I think we pointed out, Dr. Williams talked to that, but if you look at the hospital, the bed space, for example, ICU beds, ventilators, there's lots of things that go in that, but I think we met all 4 of those guidelines. But I'll let Dr. Williams address the models more, or the graphics that you're talking about maybe better than what I can. But we believe we are on the downside. of this virus here in Missouri.
Is there other data that the public could see to have a better understanding if they aren't understanding that graph that doesn't show a decline? What data should they look at?
Yeah, I think so. We have that data. I think the Department of Health has that. We've worked on a model ourselves, and I believe if that's not all of that been released public, it will be, that we've been building. I think with WashU, MU's had a place to play in it. We've had a fusion team that's helped with that across the state, but we have all that data that's in there that I think will be available to you. If it's not now, it will be.
I'm Veronica Moreski, the Columbia Missourian. Does the state have any indication on the number or percent of Missouri businesses that open their doors today?
Not that I'm aware of. Not that I'm aware of. I'm going to say, again, I'm going to go back to the reopening. We've always talked about this was going to be gradually. But I think some businesses are going to choose not to go open up right now. I think you're going to see churches in the state that's not going to have services for a while because they chose not to do that. Again, I think everybody out there, for the most part, understands the significance of this, and I think we're going to see a gradual opening of the state. Again, I'm going to go back to what I said last week. It won't be a flip of the switch. I think people are going to have to work up, and consumers are going to have to get confidence enough to go out and go back in business and spend money. Again, it's about you personal responsibility, putting yourself at risk, and how you feel about that.
Hey, Governor.
Kurt?
What do you think of the idea that nursing homes should get immunity from COVID-related cases?
That's Kurt. I mean, that's a pretty broad question. What immunity from what?
Legal from somebody
From everything?
Somebody suing them for an outbreak, a hotspot at a nursing home.
First of all, let me answer that maybe broader than you want me to, but I think it's still the medical profession too as a whole. I think the last thing we want to start is a haven for lawsuits in this state because people were trying to protect people in a COVID-19 virus situation. So I think we're really going to have to take a good look at that, because the last thing you want is good people to be getting sued because they was trying to save people's lives in unusual circumstances. So I'm not sure what the legislatures, if they've got a bill out there, how they're going to address that. But I'm going to say the last thing I want to do is open this up for lawsuits for people trying to save people's lives.
I also have a question for the treasurer.
Let's finish up with Governor Parson. Do you have one over there?
Yep. Madeline McLean with KQ2. So I am in the hot spot in St. Joseph, right where Triumph Foods is. So we opened back up today, slow rollout, similar to what you said. Is that something that you recommended or were consulted on, or do you believe is the right move?
Yeah, again, I think that was up to the local levels to make those decisions, especially in Buchanan County up there at St. Joe. I mean, again, as the governor of the state of Missouri, you have to make guidance and policy that kind of fits the whole state, which is almost impossible to do when you compare small counties, small cities to big urban areas like we have. That's why, again, it's so important for the mayors, county commissioners across the state have a role to play too. They're elected officials, and they've got to figure out what do they think is the best thing to do for their communities. And if they have a, quote, hot spot, at any time during this 30 days, they can take action. And that's why we purposely left it for them to do that in case we needed to make a change in the model on that. So, again, it goes back to what our blanket policy was, what we believe we should do for the state of Missouri, and then what they should do as individuals in that city or county.
Governor, can you explain why you decided to bring on the McChrystal group to assist with Missouri's COVID-19 response?
Yeah, because about every model that you could possibly look at that we looked at early on was inaccurate. All the reporting that was done by a lot of these think tanks from all over the United States was about as poor could be. Let me just put it that way. And what we really decided is I brought my administration in, people that was involved in this, and said, look, we got to have Missouri data. I don't want to rely on East Coast. I don't want to rely on institutions from outside the state. I want to know what's happening in Missouri. So we brought them in as an advisory group to help with the Department of Health and to help to put what we call a fusion team with Director Richardson actually head that up. Dr. Williams has been engaged with that. And so we really come in and develop one of the models, I want to say one of the best models in the United States. The Vice President called and asked about it. His Rear Admiral called last week wanting to use that for the possibility of guidance across the United States for some of the things that we were doing in that. So It was very important to get the Missouri information together and put it where we could use it to make decisions, and that's what we did. So I'm thankful they come in when they did and helped put it together.
Governor, this question is on the enforcement of these guidelines. So per your guidelines on your FAQs, it says that the state is working with local health authorities on enforcing this,
Right.
but local health authorities don't really have the resources to go in and shut down a business. What does that look like to you, and do law enforcement have any part in that, whether that's giving fines, shutting places down? What does that enforcement look like?
Yeah, there's regulations on that. There's statutory requirements. Like if you take a health department, for example, if they go in there and they see violations, they can file through the courts to get it shut down if they do it. There's a process to do on that for anybody wherever you're at, if you have those violations on that.
And how are you guys looking to maybe get that information for somebody, for a business maybe who's not adhering by those social distancing guidelines? People calling in, or are there going to be?
You'd contact your local levels, like your law enforcement, like your health centers probably would be the first place I'd call to say they're not abiding by that. And then it'd be the local jurisdictions to be able to do that.
Okay, thank you.
Yep. Yep.
I do have one for Scott, but I also had another one for the governor. But Scott, could you tell us how much exactly the city of St. Louis is getting from that CARES funding?
Sure. I think off the top of my head, I want to say it was about $35 million. The breakdown by county and the city of St. Louis, obviously, since it's not within a county, is on that COVID webpage at the Treasurer's Office site that I mentioned. So you can check my accuracy there, but I think it was about $35 million.
And you said it's coming on Wednesday. Is it all coming in one chunk going straight into the bank account?
Yeah, so we basically loaded up ACH instructions today, so the city will receive that money. It should be processed by the bank tomorrow, which means it should be in their account on Wednesday, and it'll be the full amount.
Why was it population-based? As you know, like there might be a county in northern Missouri that has 5,000 residents and no cases, but they're still going to get the same kind of per capita amount. How did you decide that as an approach?
Well, first off, the General Assembly and the Supplemental Appropriations Bill, lined out that the distribution should be based on population. But I think it's also worth noting that this money can be used anytime for coronavirus-related expenses between March 1st and December 30th of this year. And so I think it's totally possible that there could be later in the year that some of these rural counties that don't have as many cases right now could have some cases, and they could have some costs associated with that. And also, I mean, one of the things that can be done, I can tell you that obviously there are going to be costs in parts of the state related to the virus that are, because they've had a larger number of cases. And I think that the working group will look at hot spots, and if there's need for additional funding, advise the governor on that to let him make a decision on that moving forward. But I can tell you economically, I'm from a rural part of the state, and I can tell you economically, the economic impact has not just been in the areas where there's been a lot of cases. And so, one of the things that this money can be used for is economic stimulus programs, and counties have the authority to use it for that too. So I think that that's a reason to say that population was a good distribution model for the time being, and that we can look at other ways if it's necessary.
Will all counties get a single large payment?
Yes, every county will receive a single large payment. I guess it's possible that one of the remaining counties could potentially ask to not receive the full amount at once, in which case I'm sure we would honor that. But yeah, every county, as of today, all but the 7 that I mentioned, and actually Sullivan County, while I've been standing in here, has submitted an updated form, and there was one other county, I think, that needed to update some information on their form of those 7. So that was Clinton County. So we're down to basically 6 now, and they will all receive that money in one chunk.
And as the money goes out, does your office know specifically what it's being used for, or is that information that will come later?
So what we've instructed the counties to do, and what's included in the certification form that they were required to sign to us, was that they would account for that we've given them the guidance. We put some additional language in the certification document, which is publicly available on that COVID webpage, that you can read the whole document that we've asked the counties to sign, that basically gives them even a little bit more guidance than that to really hone in on things that we think could potentially be issues. And, we've told them they need to keep records associated with that because we will be audited by the federal government, at which point we'll be asking for those records to justify the use of that money. And so they understand they're responsible for the use of that money. And if it's determined at a later date that the money wasn't used appropriately, we're going to be working to recover that funding because we'll have to give that back to the federal government.
Treasurer Fitzpatrick, there's been a conflict between Jackson County and Kansas City in which Jackson County is not sharing its CARES Act money with Kansas City. Has that conflict been resolved, and which party is the unreasonable one?
Well, it hasn't been resolved, and I would say that the expectation that we've set with the counties that are receiving direct or aid from the state is that we want them to be the leaders in their local communities at distributing that money where it's needed most. And all of the counties that we've distributed the money so far have been enthusiastic about helping in that way. I spoke with the presiding commissioners of Cass County, Clay County, and Platte County, who have all understand the unique situation that Kansas City is in, being a very large city that has a lot of expenses related to the virus. And, in consultation with the governor's office, we've essentially offered those counties that we would, as the state, take responsibility for how the city spent the money if they agreed to pass that funding on relative to the percentage of the population related to Kansas City that was in that county, and had a verbal agreement with basically all three of those counties. There's been a little bit of an issue on the back end with Clay County that we're hoping to work through. Jackson County did not agree to that initially, and so far has not. They are of the opinion that the federal guidance would prevent them from administering grants to other local governments, and at least that's what was communicated to me. I can tell you that I was on a conference call last week with the governor's staff with the White House about this issue and asked for clarification to come from Treasury on that. And the last information we had is that we should probably expect some additional guidance from the United States Treasury Department on that this week. And depending on what that says, I think it will say that, yes, the counties or the local governments receiving direct aid from the federal government can administer grants. They can administer grants to other local governments. And if that's the case, then I'm sure that we'll be revisiting that topic with Jackson County and asking them to step up and do their part to support the city of Kansas City.
All right, thank you, Treasurer.
Thank you.
Any questions for Dr. Williams?
I have a question for Dr. Williams.
Go ahead. Thank you. Before any questions, I do want to just thank the governor for talking about where we are in testing. And so I just finished writing this weekend a report for the Missouri State Medical Association about kind of where we've been and where we're going for them. And so if you remember when I testified before the Senate and the House back in March, I said that here in Missouri we would recommend that we do robust testing here, and other states decided not to do that, and that has served Missouri incredibly well, and the governor has been incredibly committed to that, and we have delivered. We're in the top tier in the United States, according to the White House, and we now have the capacity to do about 60,000 tests a week, and that's growing, and different kinds of testing. And so you have to remember that. Second thing is you have to remember that really the way we look at it, we reached our peak here in Missouri among community transmission about April 6th or 7th. We've been very fortunate there. Now, again, so someone asked the question at 3:45 today, I present to the cabinet in the Fusion Cell a new website, and I hope that will be up very shortly. It is an incredibly robust, enhanced website that takes the data that we have. A lot of people have, somebody mentioned McChrystal Group, and DHSS and Todd and others. We've all worked incredibly hard to get that data that you're going to see by the end of this week in very different ways, by county, by epi curves, by percent of positive test. It's very robust to show you the information we've given the governor as he makes incredibly important decisions. And so we will have that for you. But now as we open up today, let me tell you where we are with kind of the three groups that the testing tell us about. The first thing with our robust testing, as the number of cases went down of symptomatic, and that's really what the April 6th represented. It represented community transmission, symptomatic people, 90% were coming back negative. But as we moved out of flu season, moved into that, and moved out of that, we've used that robust testing in 3 ways. And the first is that, as the governor said last week, we went into 12 counties, 9 sites that had not had as much robust testing, doing the PCR nasal swab, not antibody testing. And we did almost 3,000 tests, which is just an incredible testament to our local health departments that they were able to do that. And of those 3,000 tests, about 9 came back positive. So as we went into the 3rd ward in Mississippi County that hasn't had any cases outside of the prison down there, and we went into, Saline County, and we went into Perry County and places, if you just took people, and it was not a prevalent study, it was just taking people who wanted to be tested, and as somebody pointed out earlier, most people probably went in thinking they might have something. I don't think most people just said, well, I'll just go over there and let them do it. But again, only 9 out of 3,000 were positive. And so that kind of tells us what we already kind of saw. And you'll see this when you look at the curves, that our curve for about 4 weeks has been going down. Our percent of positive tests has been going down. Our hospitalizations has been going down. All of that's been going down. So in the last weekend, and we worked all weekend, we had about 1,000 tests, if not more, come back positive. So what's that all about? And that's the second group. Because we have this robust testing capacity now, we have adopted a boxed-in strategy. We've done that in a prison, we've done that in a nursing home, and we did that at Triumph Foods. Such that 4 weeks ago, we wouldn't have known that. You wouldn't have seen those numbers this weekend because we wouldn't have tested them. But we did, and we found that, again, at this morning, about 381 are positive who are asymptomatic. And these are people who just had their temperature taken and have been asked questions and immediately test negative. And you were asking about the Capitol here, how's it different? Well, every time I come in this building, almost, they check my temperature now when there are people here, and they ask me questions. So that's a little different population than just going to Walmart, in which people have been screened, so to speak. So they're treated a little differently because they've all been screened. So that second population is the Triumph Foods. And so let's talk about that. Of the 381, we worked on it all weekend, and we've done case contacts on almost all of them. I think this morning when I talked to them, they might have had about 30. But everybody else has been contacted, and we're now with a team from Jeff City and from other counties. They're up there talking to the people that were close to them. We're still trying to determine whether the primary form of contact is at the plant or where they live. Now, when I talked to them this morning, of the 381 positive, or 391, 200 live in Buchanan County, but almost half don't live in Buchanan County. And guess where they tend to live? Kansas City, either on the Kansas side or on the Missouri side. So we're now doing case contacts on them. But remember, these are asymptomatic people. That's very different than the testing we were doing in April. So if you look at the numbers in April, when we had our peak, versus this weekend, you're comparing apples and oranges. Those are asymptomatic people, which we think are not as infectious as those who are coughing and have fevers and those other criteria. So that's the second bucket that we're looking at. And then the third one is the one we're most concerned about, and that is our long-term care facilities. When we looked at the data from this weekend, especially in St. Louis, we see a significant amount of those patients still come from long-term care facilities, where we are aggressively trying to adopt this boxed-in strategy, where we go in, and today I've been on the phone approving to go in and check all the staff, all the patients, which we did not do 3 weeks ago, to try to box those in, because we know so much morbidity and mortality, almost 50% is coming from those places. And so when you talk about testing, we're incredibly thankful that working with our hospitals and our partners and national labs and state labs, we've developed that capacity that we said from day one would get us to a better place here in Missouri, and we in fact have delivered on that. So I would ask you to keep that in mind going forward. We will continue to do our boxed-in strategy, and we will continue to do some prevalence and monitoring, some sentinel monitoring, especially of our long-term care facilities. I was on a phone call this morning. What will that look like? 1,600 long-term care facilities in the state, less than 10% have had a case, but in those ones that had, sadly, we've lost a lot of people, unfortunately. And so we're very much focused going forward, as Scott was saying, as we look to the future, what would that look like to try to prevent that? So I want to finish with this. I practiced medicine for 30 years, and we always had a saying when I taught the medical students and residents is, don't treat the chart, treat the patient. So you can go in and look at the vital signs and say, well, they look pretty good. But if you go in the room and get ready to discharge a patient, and she says, Dr. Williams, I feel horrible. You always have to listen to that. So we're incredibly thankful for our data. We think it helps us tremendously. But we're always analyzing that data, and we're always interpreting that data. And overall, we're always looking at the patient, which for us is the state of Missouri and our 6.1 million residents. So we'd be happy to answer any questions.
Dr. Randall, so can you explain why we saw the largest single-day increase today? Is that from the cases from the meat processing plant?
Yeah, so let's take, I think Friday was like 250, Saturday was like 300, Sunday was like 300, today's like 300. So if you put those all together, you're going to probably come up with about, I think, let's say 1,200, 1,100. Well, 400 of those are from Triumph. So now you're down to 800. And so that's 800 over Friday, Saturday, Sunday, and Monday. That's about 200 a day. And that's about where we were running. And we were running about 150, 140. I'll give you another piece of data. For the first time in the longest time I can ever remember, Bill Whitmore called me today at 11:30 and said, Randall, we only had 7 cases we ran today, and they were all negative. And this is a state lab that's been running 100, 150 based on screening criteria. Today we only did 7. He's never called me before 12 o'clock and given that data. So the answer to your question is that we continue to trend down, and if we'd taken out that 400 or so tests, we would be about where we are. And you're going to see the graph, I hope, by Wednesday, that'll show you over a month our trending down of positive tests, our trending down of the number of cases, and our trending down of hospitalizations.
I guess the thing that we're confused about is you keep sort of picking and choosing. You say if you take out the meat plant, then we have trending downward.
Mm-hmm.
If last week it was if we take out the St. Louis area, we're trending downward. But overall, those numbers are still in there. Those cases are still positive. Those people still have coronavirus.
Yeah, but think of what that represents, though. What it represents is that we think now, as opposed to 3 weeks ago, when we weren't doing asymptomatic people. What the numbers 3 weeks ago represented was symptomatic people who many times are in the community transmitting the disease. As we look at it now, we think we're in a different place. We are doing a lot more testing and seeing more cases, but a big difference between now and 3 weeks ago is 400 of those people are asymptomatic. They're not like those people we were checking that you say, we're not trending down. They're a whole different group of people, and they're in a cohort. They're in one place, as opposed to representing all of St. Louis County, which is what the numbers April 15th represent by and large. Now, if you look at it, it's really representing congregated places, nursing homes and meatpacking plants, and to some degree, you look in Kansas, they had 270 tests last week positive in one prison. Out of 296 people, 75% tested positive. That's very different than 270 people testing positive symptomatically in 10 counties. Those are two very different numbers that goes back to you have to treat the patient, not the numbers.
Is it concerning?
Yeah.
Yes. So we are finding out that Triumph Foods has told their employees to head back to work if they don't have symptoms.
Yep.
And they tested positive 7 days ago, so last Monday.
Yep.
Now, is that the correct interpretation of the CDC guidelines?
It is. I've been on the phone with them 5-6 times a day, every day for 2 weeks now. And the CDC says for asymptomatic patients, remember for symptomatic patients, it's 7 days from symptom onset and 3 days from symptom resolution. But if you don't have any symptoms, you can't use those. So if you go to the CDC website, and it's on our website, they say it's 7 days from a positive test if you have no symptoms. And if you look at the press release we put out yesterday, we said, no, in the meantime, during that 7 days, if you get symptomatic, you need to let somebody know. You need to let a provider know so we can assess you.
So I have 2 follow-up questions and clarifications for that.
Yeah.
So it also says that 3 days afterwards you're supposed to limit contact. So how is going into a facility with hundreds of people, limiting your contact. And then additionally, my interpretation of the CDC guidelines for asymptomatic people who test positive would also require you to have self-quarantine for 7 days, which by my own math, they wouldn't have self-quarantined because they wouldn't have known they tested positive for at least 24 hours.
Well, again, the point is that it's from the point of when the test was done, not when it comes back positive. It's when their test is positive. So for 7 days, if their test comes back and they haven't had any symptoms during that 7 days in which their tested positive, it's the date of the test that we interpret.
So, but the first sentence. Oh, sorry.
Yes, Crystal.
Director Williams, as
Yes.
the head of the State Health Department and as a doctor that's practiced for many years, do you recommend to the public that they wear a mask especially if they're in close quarters with other people?
Yeah, Crystal, I think it's situational awareness. It really is. Like I say, I certainly, as we've said before, if you're a doctor and you're examining a patient and you're 1 foot away with a stethoscope, we think that would be a recommendation. But as we reemerge, we're certainly cognizant that there are going to be plenty of circumstances where you don't need to do that. And so, I can just tell you here in the governor's office, we are incredibly purposeful about practicing social distancing, being 6 feet away. So in my own life, I will just tell you that for the last long time, I really practice incredibly intense social distancing, so I haven't been wearing a mask because I haven't been within 6 feet, if that helps. All right. Thank y'all.
Nope, I just want to clarify one thing. No, you're doing good. It's about time to finish this up anyhow. I want to go back to the testing numbers because I know seemed like we've been talking about that a long time. However you want to look at the testing, if you want to take Buchanan County and you want to say there was 3,000 tests on that facility and they tested 381. So that's somewhere probably around 13%, I'm guessing, 13%. So if you take just those numbers, the rate would look like 13%. But if you added the other 3,000 across the state in there with that was done over the weekend that Dr. Williams said, that's 6,000. And then you would only have a percentage of between a little over 6% of the population would do that. So again, you can put the spin on the numbers. It's why I want to just say again, when you get this model out, you have to look long term at that to really know where you're at. There is going to be spikes in the numbers. We've said that almost daily because, one, you're doing more testing than we've ever done, and we're going to continue to do that. So I just want to make sure it's clear, especially for the people that's watching this briefing, that they understand that the numbers, you can pick any of them out and make a case any way you want. But the reality of it is you've got to look long term, you've got to look at a model, and you've got to really understand what's happening in the state of Missouri. So thank you all very much for being here today. Thank you.